The PREVAIL study was a single-arm, prospective, multicenter study to evaluate the PREVAIL Paclitaxel drug-coated balloon for the treatment of de novo small vessel disease and restenotic coronary artery lesions. In this study, we used this new drug-coated balloon. The PREVAIL drug-coated balloon uses the well-known free-pack coating that was validated in the Impact Falcon series of balloons. This has paclitaxel at a dose of 3.5 micrograms per millimeter squared with a urea excipitant, which facilitates rapid absorption of the drug. The drug is uniformly coated before balloon wrap. And what's really novel about this device is that it's now mounted on a semi-compliant Euphoria balloon platform. This platform makes the PREVAIL drug-coated balloon more deliverable and even usable in more complex lesions via the femoral and or radial access. So in the study, like I said, it was a prospective single-arm multicenter study in which we enrolled 50 patients in 10 sites in Europe and Asia Pacific. All these patients had lesions that were between 2 to 4 millimeters in diameter. You could include de novo and in-stent restenosis lesions, and they had to be less than 25 millimeters in length. The primary endpoint of the study was in-stent to in-balloon late lumen loss at 6 months, as measured by a QCA core lab. And then a number of clinical secondary endpoints, including death, target vessel MI, revascularization, lesion thrombosis at 6 and 12 months. If you look at the clinical characteristics of the patients included, we treated 53 lesions in 50 patients. The average age was about 65 years. 1/3 were diabetic. Most had stable angina. About half the lesions were restenosis and the other half de novo, and majority of de novo lesions were small vessels. 72% were ACC-AHA type B2C lesions. Majority of the procedures were performed by the radial approach. And as you can see from this slide, the average lesion length was about 14.5 millimeters. We pre-dilated all the lesions, and the acute gain was about 1.1 millimeter. Lesion success was very high, 94%, and procedural success was 96%. So the primary endpoint was really angiographic and looking at late lumen loss at 6 months. And as you see from this slide, in the entire group, the late lumen loss was 0.05 millimeters, which is extremely low. When you divided these groups into de novo versus in-stent restenosis, we noted that there was a negative late loss in the de novo lesions. We've seen this in other small vessel studies, and a low late loss as well in in-stent restenosis lesions of 0.12 millimeters. Here are the clinical outcomes at 6 and 12 months. And as you see, they confirm really the safety of this device. There were no issues in regards to safety, and there were no deaths, myocardial infarctions, or lesion thromboses at 12 months. When we looked at revascularization, there were in total only 3 cases of clinically driven target lesion revascularization at 12 months, giving a rate of 6%. And if you divided this in de novo versus in-stent restenosis, there was 1 TLR in the de novo group and 2 in the in-stent restenosis group. So I think overall, this study confirms the safety of the PREVAIL drug-coated balloon and also shows that it is very effective with low late loss and low rates of clinical endpoints. The impact of the PREVAIL study on everyday clinical practice is that it confirms the efficacy and safety of this drug-coated balloon and the free pack coating with this dose of paclitaxel. The advantage is that we now have a more deliverable balloon platform that will allow us to treat more complex lesions.